Good afternoon, everyone, and thank you for standing by. My name is Shirley Castillo, and I'm a health policy analyst with the National Center for Health Statistics. I'm going to be providing some logistics information for today's webinar. I'd first like to note that live transcription is being provided via the Zoom link in the chat that I'm going to provide right now. So feel free to use that. At the moment, all participants are in listen-only mode and the webinar is being recorded. If you have any objections, you may disconnect at this time. Questions or comments may be entered through the Zoom Q&A box, and we'll address them as time permits during the question and answer session following the presentation. Now I'm pleased to introduce today's moderator, Juan Albeltorio, who will provide a brief introduction of today's topic and speakers. Over to you, Juan.
Good afternoon, everybody. And Shirley, thank you for the kind introductions. Folks, this afternoon we will have a discussion of a dual perspective of suicide in Puerto Rico. For that, we have people and staff from the National Center for Health Statistics and the Puerto Rico Department of Health. On behalf of the National Center for Health Statistics, we have the demographer, Sally Curtin, and the statistician, Besaida Tejada. On behalf of the Department of Health, we have Dr. Naida Roman Vasquez, which is the Director of the Commission Prevention and Suicide, and Marisol Isabel Cos, which is a consultant for the Department of Health from Puerto Rico. Both groups will have 20 minutes of the presentation, and then we'll have a 10-minute follow-up section questions. And for that, I will leave Sally the floor for her presentation. Sally?
Thank you, Juan, and thank you for this opportunity to present suicide mortality in Puerto Rico data from NCHS's National Vital Statistics System, and today focusing on the period 2001 to 2021. And first, I'd like to acknowledge Besaida Tejada, who helped me prepare this presentation. So first of all, before we get started, I just want to talk about suicide in general as a public health issue, and a lot of you probably already know this, but we often mention in our reports just how complex suicide is as a topic. It's multifaceted with societal, environmental, interpersonal, biological, and psychological components. So it is different than a lot of other causes of death, harder to predict, but there are some known risk factors for the suicide deaths. And today we are talking about the deaths, not attempts, not ideation, not any other type of suicide data. And the risk factors for suicide deaths are, as you can see here, male, depression, or other mental health issue, the use of drug or alcohol, oftentimes, but not always, a precipitating event such as work and financial issues, a recent breakup, or family problems. Identification with a sexual minority group, and that has especially been found among the youth, and social problems as well. And oftentimes it's a combination of these risk factors which can predict suicide. So once again, these are data from the National Vital Statistics System, and we have information from death records from the 50 states and DC and the US territories, of course, including Puerto Rico. And I did check, and we've been receiving data in the system from Puerto Rico since 1932, so over 90 years. The demographic information that I'm presenting to you today on gender, age, race, and ethnicity is supplied by an informant, which is usually the next of kin. They supply this information to the funeral director, who is responsible for it to be entered onto the death record. The underlying cause of death, they are supplied by physicians, medical examiners, and coroners, and are classified using the International Classification of Diseases 10th edition. And so the codes that are in bold here are the codes that pertain to suicides, and that's what I'll be looking at today. And also, the method of suicide is typically reported on the death certificate as well, for example, firearms. I'll be showing you numbers today, but in addition to numbers, I'll be showing you rates, which we compute them as the number of deaths per 100,000 population, and sometimes they're age adjusted to a standard 2,000 population where indicated. And in terms of data for Puerto Rico on suicide from the National Vital Statistics System, and all death data from Puerto Rico are released every year in our mortality public use data files, and we do have a specific file just for the territories. It has pretty much the same variables as the file for the 50 states and DC, but it is a separate file. But we also publish data for Puerto Rico in an annual report, deaths final data for, in this case, it's 2020, the latest iteration of this report. And this is pretty much how we show the data for Puerto Rico. This is table 12, and you can see Puerto Rico is listed along with the rest of the territories. Typically in the report, the data for Puerto Rico are part of a larger table. We show all the states, DC, and then the territories. And you can see here, this is for major causes of death. And if you look over the second column from the right, intentional self-harm suicide, you can see the number in 2020, Puerto Rico 183, the rate per 100,000, 5.8, and the age-adjusted rate 5.2. So we do release data like this on suicide every year for Puerto Rico, but we have not typically had reports specifically targeted for Puerto Rico every year. So the data have been part of our larger publications. So the first thing I'm doing is I compile data, publish data from reports like I just showed you. And the first thing I'm showing you is just the number of suicides in Puerto Rico from 2001 to 2021. And you can see there's variation, but generally trending downward. The high in the period was in 2009 at 331, and the low of the period was 183. And on average, according to our data, over the period, there were 250 suicides per year in Puerto Rico. But you can see that the average for the first half of the period, 279, was about 60 more than the 219 for the second half. So these are the crude and age-adjusted rates. And you can see pretty much it looks like the trend like the number did, variation, but generally trending downward. There was particularly the rates show that upward bump from in 2017 to 2018 before it continued to proceed downward. But like I said, the same general trend, which is gradually downward. So here is the age-adjusted rate again, which I just showed on the previous graph, and I did compute a regression line through it using the National Cancer Institute's drawing point, which some of you might be familiar with. And it does show a gradual decline of an annual decline of 1.4% a year. So what I'm doing in this graph is I'm showing the trend line again for Puerto Rico of the age-adjusted rate, but then I'm also showing the US total, which is the top line, the brown line. And then the lighter blue line are Puerto Ricans in the US mainland. And so what you can see is what's been going on in Puerto Rico is different. The total US average trended upward almost the entire period. There was a brief reprieve between 2018 and 2020 before it turned back upward again. And also for Puerto Ricans in the US mainland, it also trended upward through most of the period. Now we had to start in the year 2006 for this group because we did not have the necessary populations to compute this rate before that year. But you can see that from 2006 to 2021, generally trending upwards, so that by 2021, the suicide rate for Puerto Rican people on the US mainland was higher than in Puerto Rico. And that was a change from 2006, where you can see the reverse was true. So now I'm going to shift gears a little bit. I'm not looking at rates anymore. I'm going to be looking at all the suicides and looking at percent distributions and showing you demographic characteristics of the suicides. And the rightmost column, it is suicides in Puerto Rico. You can see the archipelago, the island above the bar. And you can see the N at the bottom for 3 years. The N was 583. And in the middle bar are Puerto Ricans in the US mainland. And then on the left is the US average. And this is looking at a dichotomy, the percent of suicides to males and the percent to females. And you can see for all groups, it's very male dominated. The total US, it's 79%, Puerto Ricans in the US mainland, a little over 80%, but you can see it's even higher in Puerto Rico. Almost 85% of suicide decedents in Puerto Rico for this 3-year period were male. In this case, on this graph, I'm showing you the age distribution, and these are broad age categories. The dark green at the bottom, under age 25. The brown is 25 to 44. The blue is 45 to 64, and the orange is 65 plus. And I've also computed percentages for the percent 45 and over. And you can see just a very different age distribution in Puerto Rico, and especially when you compare it to Puerto Ricans in the US mainland. The majority of suicides in Puerto Rico are to people over the age of 45, and you can see that the modal group were the middle age, 45 to 64. And if you compare the 61.5% in Puerto Rico to 36.1% of Puerto Ricans in the US mainland, the US average was in between the two. So you can see that in Puerto Rico, it is skewed towards the higher ages. And this is the same graph except for males. And once again, the majority of suicide male decedents in Puerto Rico are over the age of 45. And it's even more so, it's a little more so, almost 2/3. And you can also see 28.7% were elderly. And it's very different than if you look at the age distribution for Puerto Ricans in the US mainland, where 36.7% were over the age of 45 and less than 10% were 65 and over. And once again, the US total is sort of in between these two. For females, once again, the percentage over the age of 45 was greater in Puerto Rico than for Puerto Ricans in the US mainland. But it is a bit different than the males in that the majority of the suicide decedents and female decedents in Puerto Rico were under the age of 45. So most of that older age is being driven by what's going on with the male population in Puerto Rico. So now I'm going to show you a comparison of the major methods of suicide: firearms, suffocations, which most of the time are hangings, and poisoning, as well as the orange bar are all the other methods together. And you can see just a very different picture of the suicide method in Puerto Rico. The bottom bar, like I said, are firearms. For the US total, the majority of suicides, 52.6%, involve a firearm. And in Puerto Rico, it's fewer than 1 in 5, 16.8%. Puerto Ricans in the US mainland is 40% of their suicides are firearm involved. And so in Puerto Rico, more than 2/3 of the suicides involve suffocation. And as I said, these are mostly hangings. There can be other types of suffocation, but the vast majority of them are hangings. In Puerto Rico, a smaller percentage of suicides involve poisoning. You can see 3.9%, which is 1/3 of the percentages for Puerto Ricans in the US mainland and in the US total. And then you have all the other categories together, which comprise 10% of suicides in Puerto Rico. And this is the same graph except for males. And typically males tend to use firearms more than females. And so the percent involving firearms is a little higher than the previous graph, which showed the total. But still in Puerto Rico, you can see fewer than 1 in 5 suicides involved a firearm. More than 2/3 were suffocation deaths. A smaller percentage were poisoning deaths, not even 3%. So you can see just a very different picture in terms of the suicide method. And this is very good information that can go into prevention efforts, knowing the type of method involved. And this is the same graph once again, but these are the female suicides. Females tend to use firearms less than males, and they tend to use poisoning more often. And you can see in Puerto Rico, fewer than 6% of the female suicides involved a firearm, whereas for the US total, it was almost 1/3. And for Puerto Ricans in the US mainland, it was 23.7%. Once again, about 2/3 of suicides in Puerto Rico are suffocation involved. For the female decedents in Puerto Rico, about 10% involve poisoning, and you can see that is much less than both Puerto Ricans in the US mainland and for the US total. Now, an interesting finding is this 18.2% of other methods, which we should look at further, and that is higher. And those can include methods such as drownings, jumping from tall buildings. Other methods are all included in there. Also, what we call cut pierce, which are things such as using a knife, and so other methods such as that. And that there is a higher percentage for the female decedents in Puerto Rico than for the other comparison groups. So in summary, suicides in Puerto Rico did decline over the period. There was variation, but a gradual decline of 1.4% annually. And that was quite a different trend than the US total and the US Puerto Rican populations, who generally experience increases over the period. However, when you compare the suicides in Puerto Rico to Puerto Rican people residing in the 50 states and DC, there were differences. For example, higher percentage male in Puerto Rico, 85 versus 80%. They're more likely to be 45 and over, and that finding was even more pronounced for males. They were more likely to involve suffocations, 69 versus 37%, and less likely to involve firearms. So I do want to mention a few limitations. For one thing, our numbers from the National Vital Statistics System on suicides in Puerto Rico are consistently lower than those published from the Puerto Rico Department of Health. And you'll see those numbers a little later in the webinar. They are higher for them. And we're not sure what this is. We know that suicides are typically underreported in vital statistics data on death certificates. So we don't know if that's our typical underreporting or if it's something specific to Puerto Rico. And there's also issues with Puerto Rican people living in the 50 states and DC, which was the comparison group, and that studies have found that deaths to Hispanic people, there's 3% misclassification, meaning that instead of being classified as a Hispanic person, often 3% of the time they were misclassified to non-Hispanic, typically white. So that would tend to lower the rates for that group within the US. And as a final thought, NCHS, we are working hard to make the data for Puerto Rico more accessible. We're planning to include this data, not just for suicide, but for all deaths in Puerto Rico. On CDC Wonder, most of you are familiar with that, the wide-ranging online data for epidemiologic research. And it's in progress now. I'm not sure quite when it will happen, but Juan is actually on that group working on that. And when that happens, it will be a major step forward in terms of making death data for Puerto Rico more accessible and user-friendly. And so here are a few links to, the first is to our data files, our territory files. And the second is to the report I showed you and other reports like it, deaths final data for 2020. And I would like to thank you for your time and attention. And now I will turn the webinar over to Dr. Roman.
Good afternoon, everyone. Thank you, Sally, for that presentation. So what we're going to do in this other half of the webinar is talk a little bit about what we do at the Puerto Rico Department of Health. Both Dr. Koss and myself are from the Commission on Suicide Prevention, which is an office within the Puerto Rico Department of Health. Those are our logos. We basically have three objectives. We want to introduce the commission. We want to present a little bit about the epidemiology of suicide in Puerto Rico, some of that data that Sally mentioned that we would be adding on to her presentation. And we want to discuss the work that we're doing here at the commission. So who are we? The Commission on Suicide Prevention is actually an office that was created by law. Act 227 of 1999 is actually known as the law for the implementation of public policy and suicide prevention here in Puerto Rico. And that gives us a benefit because there is public policy in Puerto Rico regarding suicide prevention. And the commission's job is basically to implement that public policy. So some of the things that we do, we're responsible for the development and implementation of suicide prevention strategies. We design strategies from a public health approach. We develop and publish the Puerto Rico Monthly Suicide Report. That's where we have included the data that's a little bit different from the vital statistics data that Sally mentioned. And we also oversee and offer technical assistance for the proper implementation of suicide prevention protocol. That law also created a board of directors, and that board of directors is comprised of 10 government agencies that have impact on both risk factors and protective factors for the population here in Puerto Rico. Some examples of those members would be the Family and Children's Services, the Education Department, Justice Department, what would be the equivalent of SAMHSA here in Puerto Rico, which is for mental health and substance use, and others. So a little bit more about what we do. At the Commission, because we're here at the Puerto Rico Department of Health, we like to work with suicide prevention from a public health approach. And that looks like what you can see on screen. These 4 pillars basically organize the work that we do. The first would be the emphasis on data, second, population approach, a multidisciplinary perspective, and primary prevention. And now we'll see some examples of that. When we talk about emphasis on data, that difference that Sally mentioned, our data is actually obtained from the Forensic Sciences Institute here in Puerto Rico. So what we include in our reports are actually the deaths that are certified by the Forensics Institute. We also include information for from AMSCA Línea Paz here in Puerto Rico, which is basically our crisis helpline. They're the ones who are also working with the 988. And Poison Help here in Puerto Rico. So those are our data sources. The image that you see on the right-hand side is a picture of our monthly report. All of this you can find online. Shirley will be including some of those links in the chat so that you can see them in more detail. Regarding the population approach, everything here is in Spanish because all the work that we do is in Spanish, but we wanted you to have a little look at how we try to promote our activities via the Puerto Rico Department of Health website and our Facebook page. We also disseminate this through emails. And what we have done is that we have created different workshops for different populations on different topics within the umbrella of suicide prevention. And here are some examples. We have suicide prevention in youth and adolescents. We also have suicide prevention sort of looking more towards self-care and the prevention of burnout, specifically in the context of work. And we also provide a workshop for how to develop and implement a suicide prevention protocol. The multidisciplinary approach that we use, here this graph sort of looks like the board of directors, but we've included some other sectors that have worked really hand in hand with us. And we'd have to mention in first place, faith-based communities. They're really good partners in this type of work. The media, municipalities, both public and private schools, hospital and health centers as well. And here's some examples of primary prevention work that we do. On the left-hand side, you'll see some images of some in-person and virtual workshops. We offer suicide prevention workshops in both modalities so that we can increase our reach. In the middle, you'll see a poster that we use for Suicide Prevention Month, where we try to promote as well as mental health during that month. And what you see on the left-hand side are actually 2 images from videos that we have posted on YouTube regarding suicide prevention in youth and suicide prevention in adults. Okay, and I'm going to pass it off to my colleague, Dr. Costa, who's going to talk a little bit more about data.
Thank you so much, Dr. Roman and Ms. Curtin. This has been a quite amazing experience having collaborated for this webinar with you. So I'm going to add a little bit more of data following Sally's presentation and emphasizing in that the work that we do here at the Commission really informs everything that we do, both strategies and the collaborations we're going to talk about a bit later. So this is an overview of suicides and mental health in Puerto Rico. Maybe you already have a quite great overview of suicides for the past 20 years, but in general, since 2000 to the present, more than 6,700 people have died by suicide in our archipelago. We have an annual average of not 2 191 suicides per year, an age-adjusted rate of 8.1 per 100,000 population. And as probably many of you know, over the past 6 years, Puerto Rico has suffered an economic recession, 2 Category 5 hurricanes, a series of earthquakes, of course, the COVID-19 pandemic, and most recently, Hurricane Fiona. In an epidemiological study conducted by Dr. Glorisa Canino, we know that 7.3% of Puerto Rican adults suffer from a serious mental illness. 2 out of 10 report a psychiatric ailment of some kind. 1 in 10 suffer a severe depressive disorder, often without treatment. And interestingly, in this report, it shows and validates how social support affects disorder prevalence. So she studied the difference between psychiatric disorders from people living in Puerto Rico and the archipelago with Puerto Ricans living in the US. So I don't want to repeat any of the data that Sally shared, but we really want to emphasize this point, right? That historically in Puerto Rico, hanging has been the most common method used in suicides, both for men and women. And this is one of the most significant epidemiologic differences from suicides between Puerto Rico and the US population. And we also want to emphasize who are the disproportionately affected population that is dying by suicide in Puerto Rico. And we have confirmed over the years that it's men over 50 years of age. And that's why when we are going to talk about our collaborations, you'll see an emphasis on responding to this necessity. These are the municipalities. The ones you see colored in red are the 10 municipalities with the highest suicide age adjusted rates for the period of 2015 and 2019. So we have Ay Bonito, Orocovis, Adjuntas, Rincón, Camuy, Barranquitas, Coamo, Aguadilla, Jayuya, and Lajas. For those of you that don't know our archipelago, I just want to point out, I don't know if you see my cursor, but maybe Dr. Roman can help me. The central part of the bigger island is a mountain region. So it's very mostly known as a rural population. So I think Dr. Roman was pointing out the metropolitan area. You can point out the metropolitan area in the map. So this is important to point out because we see that most of the health services are concentrated, very concentrated in the metropolitan area. So when we talk about these highest suicide rates in municipalities, we have to acknowledge the access to healthcare, access to quality of housing and living. So this is important. And also want to mention that these municipalities in the northern west side of the bigger island, also in the south, have a great aging population. So they at least have more than 45% of their households living people older than 60 years old. So adding to the data that Sally shared, we want to point out that in Puerto Rico, we have a great surveillance system within the Puerto Rico Statistic Institute through the Puerto Rico Violent Death Reporting System. So I just want to shed light on and provide a bit more context of the circumstances of deaths of suicide in Puerto Rico. So the variable that is quite similar both in suicides and homicides is the level of educational attainment. So formal education, we see that, and I'm sharing data from the last report of the PRVDRS for 2020. So in 2020, 63% of people that died by suicide did not obtain an education higher than high school. And of those, 34% graduated from high school or earned a GED, and 29% did not complete high school. So we just want to point out how important it is for people in Puerto Rico to have access to quality higher education. These are some general documented circumstances. I just want to point out the first two. So almost 23% of people that died by suicide in 2020 had a history of suicide attempts, and 22% had a history of suicide ideation or had made a previous plan. This is quite valuable information for people like physicians and nurses working with populations here in Puerto Rico to be quite aware of what instruments to use to assess for suicide risk. And these are documented mental health circumstances. And again, I'm going to point out the first two. Almost 50% of people that died by suicide in 2020 were identified with a current mental health problem, and 46.7% were perceived as depressed. And we always point out that being perceived as depressed is not the same as being formally diagnosed with depression, which can be a barrier for access to mental health services. Talking about mental health diagnosis, we know that in 2020, 50% of people that died by suicide had a mental health diagnosis. So we just want to be specific in which were those diagnoses. So more than 70% of people diagnosed with mental health diagnosis at the moment of their death were diagnosed with chronic depressive disorders, followed by anxiety, bipolar disorder, and schizophrenia. And as you know, we have been impacted by many disasters, specifically in 2017 with both hurricanes Irma and Maria, and the PRVDRS documented 22 suicides in the 6 months after September 17, after hurricanes Irma and Maria, where exposure to those disasters was perceived as a precipitating factor for suicide. Documentation reported that the victims, due to the hurricanes, had lost their belongings, had a lack of access to water and electricity. Their businesses filed for bankruptcy. They felt anxious in the aftermath of the hurricanes and had no resources to rebuild their homes. Additionally, since I'm sharing data on the annual 2020 report, we know that 7 suicides were associated with disasters, 6 with the COVID-19 pandemic, and 1 suicide was associated with the 2020 earthquakes. And I want to point out that, as Sally mentioned, if family members or next of kin don't report these factors, or the interview isn't conducted in a profound way, sometimes that data won't be documented. So this is the documented data we have for the circumstances of deaths by suicide. So what do we do with this data? What we do and what we emphasize at the Commission is raising awareness through education. And we do this by, in every educational activity or training or workshop, we address common myths, presenting up-to-date suicide data, increasing knowledge on how to support someone at risk. And those are the key elements in every educational activity we conduct. These are the target groups with which we collaborate on a monthly basis. Every workshop is targeted to these groups. So school personnel, health professionals, faith-based communities. For us, it's very important to target the male population, the general public, and community health promoters that tend to be also community leaders. Next. So Dr. Roman showed our promotional pages for these workshops. So these are the main topics. We cover suicide prevention in men, addressing how masculinity or machismo can be an important factor in risk for suicide in men. Suicide prevention in children and youth, how to develop a suicide prevention protocol, which is a public policy here in Puerto Rico. We cover also self-care strategies and how to prevent burnout. And we offer support to people working using telephone calls about how to manage people in crisis through telephone calls. We also have developed 2 online, free of cost, online courses These are the titles. So it's suicide prevention in disaster situations and the media's role in suicide prevention. Both courses you can take at your own pace. They are in Spanish and they are available 24/7. We're going to share those links in the chat. And now I'm going to pass it over again to Dr. Roman to close out our presentation.
Thank you, Dr. Cos. Now we're going to share a little bit about some special collaborations that we would like to highlight. These aren't all of the collaborations we've had. It's not an exhaustive list of who we've worked with, but these are particularly important collaborations for us. So we wanted to start with the Governor's Challenge here in Puerto Rico. We also have a team here. The commission is one of the co-team leaders with the governor's office in Puerto Rico. And we've been working on this maybe for the past almost 2 years with the Governor's Challenge. Currently, we have a pilot project with a hospital, a psychiatric hospital, which is in the municipality with the highest suicide rate in Puerto Rico, which would be Ay Bonito. And they are working on priority area number 1, which is identifying and screening for suicide risk, not only in veterans, but in service members and in their families. And they're working on the Ask the Question campaign. We've also collaborated with the National Hispanic and Latino Mental Health Transfer and Technology Center. Here are some pictures of an activity where Dr. Cos offered a workshop over there regarding the role of media in suicide prevention and suicide prevention in Puerto Rican males. She also talked about some self-care strategies for Latino community health workers. We've also worked really closely with one of our members of our board of directors, which is the Department of Education. The commission, we actually offered education, continued education to roughly 75% of professionals working in schools through the suicide prevention in children and youth workshops. So that 75% translates to 2,550 nurses, psychologists, social workers, and professional counselors from the Puerto Rico Department of Education that participated in this. And I would have to say that this would not have been possible without the collaboration of the education secretary, who actually supported us in allowing all of these employees to take time off and be able to participate in our workshops. We've also collaborated with the police department here in Puerto Rico, and we want to highlight specifically the workshop titled How to Report Deaths by Suicide in the Media. This was really important to us, specifically because when something happens in Puerto Rico, the police would be the first place that the media goes to. So we were able to get all of these people to take the online course that Maria had mentioned. And afterwards, we did a follow-up workshop, which was in person. There are some pictures of that activity where members of all of the offices that appear here, the criminal investigations directors and assistant chiefs of homicide, the directors of domestic violence, directors of sexual crimes, and the press officials from all 13 police areas in Puerto Rico were able to participate. We even did a role playing, and they had a lot of fun with Maria, making her act like she was a police officer that had to answer the questions from the press so that she could feel the heat that they feel when the press insistently asked on details regarding violent deaths. We also work with the Department of Corrections and Rehabilitation. We offered some virtual suicide prevention talks with groups of men and women from all correctional facilities throughout Puerto Rico. Those would be Bayamón, Guayama, Ponce, and Mayagüez. Now, what are we doing for strengthening the Puerto Rico suicide prevention infrastructure? We are very proud to let you know that we are a part of the CDC Comprehensive Suicide Prevention Program. Maybe some of them are connected to this webinar right now. Thank you for your support. We actually got into this initiative for the cohort of 2023. We're just starting off, but we're so excited because we had originally submitted in 2022 and we just got invited back in 2023. Later, we can share those links so that you can see what the Comprehensive Suicide Prevention Program is about. Here are some of a little bit more information regarding the approach. I'm just going to mention some things that we will be working on: multi-sectoral partnership. We've already identified our disproportionately affected population. Something that's going to be really, really new and innovative here in Puerto Rico is that for the first time, we're going to be working on syndromic surveillance for Puerto Rico, and we've never been able to work on that aspect. We'll be identifying some gaps in services and communicating trends, progress, successes, et cetera, to our partners. Okay, and also we would like to let you know that we are a part of SAMHSA's National Strategy for Suicide Prevention. Also, we joined that cohort this year, and through this grant, we'll be partnering with primary care clinics, specifically with federally qualified health centers here in Puerto Rico in the 5 municipalities with the highest suicide rate. We will also provide education for policymakers, and we will be reducing access to lethal means. We will be developing a webinar regarding that. Okay, so here's a little bit, of a summary. We'll develop that suicide syndromic surveillance system. We're going to strengthen those multi-sectoral partnership and coalition work, implement and evaluate our efforts. And with all of this, we aim for a 10% reduction in mortality and morbidity in males 50 years and older. Okay, so this is the last part of our presentation. We do have more information that we would like to share with you, so I'm sure there's some questions in the Q&A. I just wanted to thank everyone for actually joining us. We did not imagine that so many people would be interested. I saw the participant number a few minutes ago, and I was surprised when I saw it. And I just want to maybe close the presentation saying that our work from public health at the Puerto Rico Department of Health is always with a human touch. So we are very aware, and we keep this in mind, that the topic that we're discussing isn't only about data, number, and trends, it's about lives. And we keep that very present. And I would say that that is our trademark. So thank you for listening.
Thank you so much to all of today's presenters. We're now entering the question and answer session, and as time allows, the presenters will address questions from the Q&A box. So if you haven't already submitted your questions, please go ahead and submit those through this feature now. And we've got a very good question here. And I think that this might actually be directed towards either Dr. Roman or Dr. Cause. It says, concerning the differences between mainland and PR suicide rates, how did presenters take into account the fact that many people on the island moved to the mainland after massive hurricane damage during the period studied? Could those who have moved to the mainland have contributed to the increase in US suicide rates during the study period, or made the PR rate lower than it would have been otherwise because of their absence in the stats? So I'll open that one up to either Dr. Koss or Dr. Roman.
Dr. Koss, I think you can take that question.
Sure. I think the point that you're making is completely true, in the sense that we have documented quite large migration after Hurricanes Irma and Maria, myself included. So many people had to leave due to the shortage of electricity, and that's why we had this sense of urgency to be very aware of where we obtaining our data. We collect our data, as we mentioned, from the Forensic Science Institute. And the age-adjusted rates also help us to be aware of those demographic changes. And of course, I think if you look more specifically to Sally's presentation, you will see a trend, right? You will see a historic trends from 2001 to 2021. So that also gives us a sense of the variability, and also what was happening in Puerto Rico during those years. So we have seen that the highest number of suicides have been and rates are concentrated in 2009. And we can also hypothesize about what happened across those years. But again, 2017 was a year that changed all of our lives. So we do take into account those experiences, and that's why we And I would like to address another question that I saw, that we need to collaborate to make our data more with less discrepancies, to say that. So here at the Puerto Rico Department of Health, we work with the Puerto Rico Violent Death Reporting System. They consolidate data from the police departments, from the Forensic Sciences Institute, and vital statistics, which also helps us to have valid data reporting. And of course, we are collaborating with Sally and Juan and Victorio to have this data as clear as possible without so many discrepancies.
Thank you
Sally,
so much.
yes. I don't know if Sally wanted to add something regarding that question, but those were my 2 cents.
Well, it's a great question. And I just want to say the comparison group in the US of Puerto Ricans, it's not just recent immigrants. It was any decedent whose next of kin or informant identified them as Hispanic of Puerto Rican ancestry. And of course, we do know that in general, the population of Puerto Rico is aging the quickest of almost anywhere in the world. And so the idea that maybe some of the people, especially that 25 to 44, which if you remember, that was the modal group for the Puerto Ricans in the US, whether, you know, they were some of the group that came over and then they're contributing sort of to the higher rate on the mainland and also lowering the rate in Puerto Rico. I mean, that's entirely possible. So we need to look further maybe in how recent how recent they came to the US mainland, like if they came in the last, say, 6 years, and then we could pinpoint maybe how much of that effect is contributing to the trends. So great question.
Thank you so much, Sally. And we have a bit of a follow-up question to that as well, since we're already discussing the events of Hurricane Maria as well as the COVID-19 pandemic. It says it seems that the number of suicides was a bit lower than in other years. And can you comment on those two separate events and the possible association with suicides? And this might be for the Puerto Rico Department of Health staff.
Yeah, I just wanted to point out that that is a question that is asked of us even here in Puerto Rico. Like when we facilitate workshops, that is something that comes up. People associate that automatically because of all of these disaster situations that have come up so frequently with such little time between each of them, that would automatically translate into increased suicide rates in Puerto Rico, and that wasn't necessarily the case. So that's something that we have to sort of demystify here in Puerto Rico as well. And what we would say, even though it sounds so cliche to use the word resilience, but I do think that we have to look at the cultural differences in our population and how we face these adversities. And maybe there's some key elements to how we deal with those adversities and how that translates into that suicide rate isn't necessarily going up. And I think that it's important to keep in mind that in situations like that, what takes precedence or the most important thing that people have on their minds at that moment is survival. So people are very focused on, you know, I need water, I need food, trying to share that water and food with your neighbors, with your loved ones. And we've observed, I think this is information that we've also observed in other disaster situations like Hurricane Katrina, that not automatically after a situation like that, you're going to see those suicide rates come up. So I think that we would have to look at the specificity of our cultural differences and how that sort of gives us, I don't know, it's beneficial in moments of difficulties such as those faced both for Hurricane Irma, Maria, because I know we mentioned Maria a lot, but just a few weeks before, September 6th was Hurricane Irma and September 20th was Hurricane Maria. So it's a combination of both of those hurricanes.
Thank you so much, Dr. Ramon.
Shirley, maybe I would like to add to that, that we have data on our crisis helpline, and that is something we've taken into account. The crisis helpline here in Puerto Rico, Línea Paz, has existed for more than 20 years, and they've never received more calls in their lifespan of the crisis helpline than in during the COVID-19 pandemic. And I think this person also mentioned this emergency. What we have seen is that while the utilization of the crisis helpline has increased significantly, suicides not necessarily has increased. And what we know is that when people at a suicide risk situation call a crisis helpline, that is an act of trying to ask for help, right? So we would think that reduces the risk of death. So when we talk about disasters, we have to be very aware that human suffering, right, and not having access to electricity, water, food, that has an effect in our emotional and psychological well-being. But that does not necessarily will translate, as Dr. Roman said, automatically to higher suicide rates. You have to take into account the social support, family support, and also the resilience of each person, right, within their circumstances. So if you want to look more specifically in the documented deaths by suicide associated with disasters, I would refer again to the Puerto Rico Violent Death Reporting System, and that is also mentioned in our presentation.
Thank you so much, Dr. Koss. We have a couple of questions in the chat related to the availability of data on socioeconomic status of the victims of suicide, as well as if we have any information on how Puerto Rico compares to the US mainland in terms of the ratio of behavioral health professionals and services per population. So can either of you speak to that, or potentially Ms. Curtin?
Well, on the death certificate, in terms of socioeconomic status, we are limited to educational attainment. That is something that we can look at. We have to use sort of special populations to do that, but we are somewhat limited in those variables on the death certificate. So.
Thank you. Okay.
Maybe I could, Naida, did you want to say something?
No, I just wanted to mention the variables that were included in the PR-BDRS, that maybe that's what you're going to mention.
Yes, and also the Puerto Rico in its entirety is considered in a health shortage area by HRSA. And when you look at how many physicians or health professionals work providing services in rural communities, you will see a great difference between Puerto Rico and the US. And of course, I think it's known that Puerto Rico is the jurisdiction with highest poverty rate. So there is no doubt that we have serious social and economic challenges to deal with, and that has to do, of course, with suicide rates.
Thank you so much. There's an additional question in the chat related to the peak of suicides in Puerto Rico in 2009. Was there an event, disaster, or conditions that may have caused that?
That's a question that we also get asked a lot here in Puerto Rico, and something that comes up a lot, even though we don't have like a formal study to be able to establish the correlation or any causality. Something that is in the minds of everyone here in Puerto Rico was that in 2009, there was a law passed sort of to promote some fiscal stability, and that fiscal stability was targeted via a massive layoff of government employees. So 2009 is known for this law, Act 7, that was very ill-received by Puerto Ricans. And it is known to this day that that act had absolutely no effect in terms of the fiscal stability that they were searching for at that time. So this would be the major event in Puerto Rico that we can point out in 2009 that could sort of speak to why that peak was there. The commission does exist since 1999, and we would say that we didn't have a protocol for suicide prevention until 2015. So there's also sort of a gap in what was being worked on in terms of public policy regarding suicide prevention during a big part of that initial phase of the policy. So I think that that's what I would highlight from 2009.
Thank you so much, Dr. Rahman. We have an additional question that's related to the hurricane in terms of whether a lot of people left Puerto Rico and if that could have in some way contributed to increased risk of suicide for people remaining in Puerto Rico. So they listed examples such as increasing feelings of loss, isolation, lack of options, etc. Would Dr. Roman or Dr. Koss be able to speak a little bit to how that may have been a precipitating factor?
Yeah, I think that it's important. Before, when we were getting organized for this webinar, Sally also shared with us an article regarding the aging process here in Puerto Rico. It was mentioned at some point of the webinar that Puerto Rico is one of the most rapidly or the fastest aging populations within US jurisdictions. And even worldwide, it's in the top list. So something to keep in mind with that aging population is also that the aging is not only because people are getting older, but because the ages in the middle of that population pyramid are leaving, right? So when they leave, the population that is left is actually older. The people that leave are also the social support of the elderly here. So we're talking about children, we're talking about grandchildren that are no longer here, and the people that are left in Puerto Rico within that older age margin are actually left without their social supports. So a question that has arisen and that is very important to us right now, and it's been talked about in the media recently, is the question regarding who will take care of the people that are left here in Puerto Rico as they age. You know, the people that are supposed to be taking care of them no longer live here. And that is a very big challenge in terms of creating other social supports to be able to continue having some quality of life. So I would highlight that specifically for that question. And I think that that might even be true to some extent for the people that leave Puerto Rico. Where are their social support? Their parents are here, their uncles and aunts are here. And, you know, maybe there's something there that we should look at. This is just a hypothesis, but I think that social supports looks different for the people that are left here in Puerto Rico. And it can be a challenge for those young folks that also leave Puerto Rico.
Thank you so much for that answer. And I think that that's all the time that we have for today. So I want to give another thank you to our presenters, Dr. Rahman, Dr. Koss, Ms. Curtin, and thank you to all of you who have attended and for all of your questions in today's webinar. Please feel free to save the chat with the resources that have been posted throughout the webinar. A recording of this webinar along with the presenter slides is going to be posted on the NCHS website in the coming weeks. Again, thank you for your attendance and have a great day.